Region 5 in southern Illinois has 2 open ICU beds. The Illinois Department of Public Health says they're still dealing with an influx of patients.
News 3's Madeline Parker joins us live in studio tonight with how ambulance services have had to adjust when hospitals can't take any more patients.
Mark, Julie, ambulance services spend their days responding to 911 calls and transporting patients to hospitals when they cannot take themselves. Problems occur when the closest hospital ambulances can go to is hours away.
And I've been in EMS for 29 years and I've never experienced anything like this before.
Paramedics, ambulance services, and EMS across southern Illinois experienced staffing shortages before the pandemic. But when COVID hit healthcare workers, it also hit emergency services.
Really, when the pandemic hit, it accentuated our weaknesses. It found the weak spots and exploited those. And
hospital rooms, ICUs, and critical care units filled with COVID patients, and EMS and ambulances had to go to new lengths to find room to take those who needed care.
We're fulfilling the needs for our communities, but we're really doing it pushed to our limits.
Problems arise when local hospitals cannot take patients.
Recent unavailable ICU beds in our region, it results in longer patient transport times because we have to find the beds that would be available at more distant hospitals. So we transfer patients longer, which results in our ambulances being out of our area longer.
What used to be a drive within the same town or county could now be a 5-hour round trip to St. Louis, Peoria, or even Tennessee, and leaves less workers able to respond to calls.
Hospitals are seeing the worst of it, and EMS is really starting to feel the strain as well, because honestly, EMS is the last safety net for healthcare in a community.
While the EMS is working with the IDPH to think of out-of-the-box solutions to the current transport issues, there doesn't seem to be an end for the problem, while hospitals are still overwhelmed. Live in studio, Madeline Parker, News 3.